Welcome to my talk on the surgical patient and aid to clerking, part 2. Now we come to clerking of a surgical patient. Okay, what is this clerking? This clerking is the process to arrive at the diagnosis in the patient. To do this, we collect the symptoms and signs from the patient through a complete history and physical examination to be conducted on the patient and come to a diagnosis. A clinical diagnosis consists of a provisional diagnosis and a few differential diagnoses. In order for this process to be ideally conducted, you need some prerequisites. And what are they? These are the five prerequisites for such a condition. First and most important is a rapport with your patient. Okay, you have to have a good rapport with the patient so that he can be freely express his symptoms and signs to you. Next is allay the fear and anxiety the patient may be undergoing. Then your attitude to patient is another important factor. Then empathy for the patient's sufferings or the emotional setbacks that is undergoing because of illness. And lastly, to appreciate despite not he may not be agreeable with he may be uncooperative, but to appreciate his behavior, abnormal behavior at times. Okay, now what is your right attitude to your patient? Okay, the patients are not mere objects, but living humans with emotions like you and I. Okay, this is very important to understand this concept. And there are some unwritten rules to adhere when dealing with your patients. And these are, first, the patient is always right as far as his disease is concerned. Secondly, treat the information he gives you with utmost confidentiality. Thirdly, always respect his decision on treatment options. Fourthly, the patient knows his illness best. And lastly, treat always, cure sometimes, but never cause harm at any time. Okay, this should be the motto of your relationship with the patient. Okay, number of things to remember when you are dealing with your patient. Okay, clerking a patient is an art that can be learned by interacting with the patient as much as possible. Okay, that's the only way. The more time you spend with them, the better the acquisition of your skills, clinical skills and wisdom. Secondly, this learning process in medicine is a lifelong one, and it gets better with time and experience. Thirdly, the adage for the saying, the more patients you clerk, the better your skills in diagnosis is very true. As a medical student, it may not be easy to get what you need from your patient. He may appear indifferent, uncooperative, and even angry with you for probing into his privacy. But if you get started with the right attitude and put in some special efforts to know your patient well, the rest will fall in place in due time. Okay, now we come to the actual assessment of the patient. In order to assess the patient, you must know what is a symptom and what is a sign. Okay, a symptom is what the patient complains to you, such as pain, vomiting, cough, and so on. Whereas a sign is something, a finding that you find on the patient by his examination. Or these are signs noticed by other people. Example, pallor, jaundice, a swelling or a mass somewhere. Okay, these are considered signs. So very important to elicit the symptoms and signs from the patient. Now, what are the common symptoms in surgery? In surgery, there are the history taking will reveal a number of symptoms. Okay, among which pain is the most common symptom in surgery. Most common, and you must be able to work out its onset, duration, progress of the pain, radiation of the pain to other sites, severity, okay, aggravating and relieving factors, and so on. All these are important factors that you must be able to uh, get in detail from the patient. Next is a lump or mass or swelling, whatever the patient may choose to describe. So the onset of the pain, the duration of the pain, diffuse, localized, and changes around the skin or overlying the swelling. Thirdly is bleeding. Okay, bleeding can be anywhere, and the most common bleeding in surgery will be hematemesis or vomiting of blood, melena or hematochezia, passing of blood in the stools, and hematuria. Okay, passage of blood-stained urine. And you must be able to record the amount of bleeding, the color of the bleeding, the presence of clots, and whether it is associated with pain or otherwise. Other less important ones are symptoms or complaining of an ulcer, the sinus or a fistula, and this you must be able to get from the patient the size, shape, ages for the ulcers, the base of the ulcer, and also the surrounding changes. Although this will be more clearly seen when you examine the patient, but you may be able to get some information from the patient. Then discharge from the wound or the swelling that the patient complains of. Okay, you must be able to find out whether it is serous discharge, yellow in color, pus discharge, mucus, or very important, whether there is blood stain discharge, which is usually a sign of malignant change. Then fever, must be able to record the nature of fever, how high the fever is, associated with chills and rigors, and also the other associated symptoms such as nausea and vomiting. If there is vomiting, then you must be able to get the description of the contents of the vomiters, color, whether it's projectile, whether it's frequency of the vomiting, and the severity. Now, what are the common signs in surgery that you see in our patients? First, lump is one of the most common signs that you can get. The lump, mass, the swelling in whatever region that may be. Secondly, tenderness, okay, the presence of pain when you apply pressure on the side at the site. Jaundice, yellow discoloration. Pallor, okay, is a sign of anemia. Guarding, okay, and rigidity. Loss of function due to pain, especially over the limbs. Edema, peripheral edema or ascites. Wasting, emaciated, and cachexia, which are usually due to malnutrition, chronic illness, or malignancy. Physical examination or elicitation of signs. What you do in order to elicit the signs in the patient. There are 4 steps in the physical examination which you're familiar with: inspection, palpation, percussion, and auscultation. And then under the inspection and examination, first you have the general examination, appearance of the patient, whether he's in pain, nutritional status, position of lying, comfortable, whether is he in comfort, breathless, pallor, jaundice, cyanosis, examination of the palms, examination for pedal edema, and also the pre-morbid medical conditions. Okay, these are all general examination and mainly is in the inspection. The other one is specific in the examination, where you examine a lump or a swelling in the region where it occurs. That is specific examination or regional examination. Okay, so you examine for example, a ulcer or a sinus, and then you examine the region where it occurs. In general, it is actually the system. So if the patient complains of abdominal pain or vomiting, then the specific examination will involve examination of the abdomen. Once once you know how to clerk a patient, get a history and look for examination, for signs in the examination, you must follow a certain format of clerking and presenting a case. First of all, the case history. These are the important things that you must look for in the case history. Identifying data. Okay, the most important among them is your age of the patient. Okay, by knowing the age, you can exclude quite a number of illness in the patient, in that particular patient that you are dealing with. The chief complaints in chronological order, that's very important. Okay, so the symptom that comes first must be reported first. History of present illness, again in chronological order. A detailed description of the symptoms that the patient gives us, apart from the chief complaint. So the chief complaint is what the patient complains or brings him or her to the hospital. Secondly, the history of present illness, a detailed history of the chief complaint and other associated complaints. Okay, then you have your relevant, associated, positive and negative symptoms. Review of system. All the systems must be reviewed. Ask a few symptoms from each system to suggest the system is either functioning normal or abnormal. A detailed obstetric and gynae history in female patients who may be relevant. Past history, very important, especially if there's a past history of surgery, surgical procedure. You must go into the details of the surgical procedure. Okay, what was done, and get as much information as possible from the patient or from the relatives. Drug history, especially allergy drugs and drugs causing gastric problems, NSAIDs. Family history, especially of malignancy, and detailed nutritional, diet, social, and occupational history. Okay. So under physical examination, you go to general inspection, vital signs, important, BP, pulse, and fever, temperature. Relevant signs relation to chief complaints. Local specific examination of the patient, okay, in relation to the chief complaint, and review of all the systems. You must examine the patient from head to toe, all the systems. Once you have completed physical history and physical examination, next you must come to a clinical summary. Includes history and physical examination. This must be short and precise in about 5 to 6 sentences only. After which you come to from your summary, then you go to your provisional diagnosis, which is the most likely diagnosis based on the symptoms and signs in that particular patient of yours. Then the differential diagnosis, you must offer at least 3 differential diagnoses if possible, which are other possible diagnoses in the patient. Then next you go on to investigations. Okay, and these investigations are to either confirm your diagnosis or exclude your certain diagnosis in the patient. And it's important that it must be always start with the most simple investigation, least invasive form. Okay, and with minimal or no complications or radiation. And also it must be costly. So these are the factors to consider in a patient. Okay, don't go into a most complicated investigation at the start. Go from the least invasive to the more, then build up to a more complicated investigation. Definitive diagnosis can be established, may be established after the investigations are complete. And once you get a final diagnosis, then you go into management and treatment, and you must have a outline of the plan for the treatment of this patient. Okay, now what are the outline management in general for surgical cases? In any clinical scenario, you collect the symptoms and signs from your patient and come to a reasonable provisional diagnosis. Consider at least 3 differential diagnoses for him or her, and think of investigations you will perform to confirm or exclude certain diagnoses. These include blood analysis, blood tests, urine and analysis of fluids and discharges, After which you go to the imaging methods, techniques such as plain X-rays, chest X-ray, abdominal X-ray, ultrasound scan, abdominal ultrasound, endoscopic ultrasound, CT scan, CT angiograms, magnetic resonance imaging, MRI, PET scans and others, and radioisotope scans. You need not do all these in one patient, but then usually you start off with a plain X-ray and ultrasound, and then from the results of these investigations, you decide what others you want to proceed on with. Then you may go to endoscopy such as OGDS, ERCP, colonoscopy, sigmoidoscopy, okay, video capsule endoscopy, and endoscopic ultrasound, angiography and venography in cases which are relevant, and finally biopsy, which can be a fine needle aspiration cytology, true cut or core cut biopsy, incisional or excisional biopsy. In this order, you must do the procedures, order of as shown in here. All right. Now, once you have got the diagnosis, then you go to the treatment. Okay, the treatment involves first step, preliminary and resuscitation with IV fluids and electrolyte replacement, analgesics, antibiotics. Okay, these are all important preliminary investigations, and what you do depends on the severity of the patient's condition. And while doing this, you must ensure that the patient is adequately monitored with monitoring of the blood pressure, pulse rate, arterial saturation, and urine output. These are the commonly done simple procedures for all patients. Secondly, non-surgical treatment or conservative treatment. Okay, the use of medications such as antibiotics, proton pump inhibitors, and so on, depending on the diagnosis. And thirdly is surgical treatment. Okay, if the patient there's an indication for surgical treatment, then there are few types of surgery this can be done. First is your minimally invasive surgery or endoscopic surgery, laparoscopic procedures, robotic surgery, and of course the traditional open surgery when all others are not possible. Then there's something known as the emergency with elective surgery. Yeah, emergency surgery is surgery done as soon as possible because of the urgency of the situation. So these patients are not ideally prepared. Therefore, the complications following these surgeries may be higher compared to elective surgery, which are planned and the patients are adequately prepared. So the complication rate from elective surgery is very much less. Okay, this is a chart showing flow chart showing you the outline of management of a patient. Okay, first you take the history, physical examination, come to a provisional and the differential diagnosis. Then subject the patient to a number of investigations like blood testing, urine, fluids, exudates and discharge. Then you go to imaging, plain X-rays, contrast studies, ultrasound scan, CT scan, MRI, radioisotope and PT scans. Okay, the first few until ultrasound will be the most patients will be subjected to, and the others depending on the needs of the patient. Then you have an endoscopy such as OGDS and colonoscopy are the most commonly done. Then you have ERCP and video capsule endoscopy nowadays. And finally, to get a definitive diagnosis, you must do a biopsy. Okay, tissue diagnosis. And this can be a fine needle aspiration cytology, tissue or true cut biopsy, and open biopsy. Okay, with all these investigations and biopsy, you get your final or definitive diagnosis, which then you institute the definitive or proper treatment, which includes resuscitation, which I said, non-surgical treatment or medical treatment, and if surgery is needed, you go for surgery. And as I said, surgery can be either minimally invasive, endoscopic, or open surgery. It is important to prepare the patient for surgical treatment and also look into the post-operative treatment of the patient. Okay, you must have a line of treatment option plan and subject to proper preparation and post-operative treatment of the patient for best or ideal results of the operation. Okay, thank you for your patience for this short lecture. I hope this would have enhanced your understanding of how to go about clerking your patient. Thank you and see you again in another session.